Rehab Protocol for a Pectoralis Major Muscle Rupture. In this video, I will be showing a rehab protocol for a pectoralis major rupture. The most common injury mechanism is during eccentric shortening of the pectoralis major under heavy loads such as the bench press. Injuries to this muscle occur primarily during lifting activities that require contraction with the arm in external rotation and extension. During this surgery, they will go in and reattach the ruptured muscle or tendon back to its original insertion point. Phase 1 of the rehab protocol will be weeks 1 through 3. Some of the goals for this phase are going to be to introduce light activity to the arm while maintaining strength and functionality of the distal portions of the arm, such as the wrist and elbow. And some of the restrictions for this phase are going to be to limit passive external rotation and abduction, as well as limiting active internal rotation and adduction. And this is going to be to allow those recovering tissues to heal properly.
Okay, for the first exercise in phase 1, we're going to be doing pendulum swings with no resistance. So what she's going to do is she's going to be bent over like this, and then she's going to passively swing her arm in a circle. Okay, be sure you're not actively moving it. And she's going to do 3 sets of 7 swings in each direction. And you can stop now.
Okay.
And that's just going to be able to strengthen the muscle and get the muscles of the shoulder moving a little bit post-operatively. Okay, so for exercise 2 of phase 1, she's going to be doing wrist curls with light resistance. She's going to be doing 3 sets of 6, and this is going to be to strengthen the muscles in the distal portion of the arm and to prevent atrophy post-operatively. So just flex up. Good. And on these, she's going to be sure she's not using her shoulder at all and just flexing the wrist, just to get the wrist active and keep the strength in that joint. Okay, so for the third exercise in phase 1, she's going to be doing elbow flexion with no resistance, and we'll be doing 3 sets of 6 of this one, and this is going to be to keep the elbow joint mobile and help strengthen the elbow flexors. So you're just going to arm straight, there you go. Yeah, and you're just isolating that elbow joint. And if she wanted to, we could pronate or supinate the hand to hit different muscles like that. All right.
Phase 2 will include weeks 4 through 6, and some of the goals for this phase will be to, again, maintain full range of motion in the elbow, wrist, and hand, and working on achieving active assisted range of motion in the shoulder joint, and basically just working on getting the pectoralis major muscle reintroduced to some of its primary movements very gently. In this phase, we are going to limit active resisted internal rotation and adduction, as well as limiting how much we stretch in external rotation and abduction, just so we can be sure those muscle fibers don't get re-injured.
Alright, so for the first exercise in phase 2, which will be weeks 4 through 6, we're going to be doing the pendulum swing again, but this is going to be with light resistance. And so you could use any kind of light ball, but we're using just these 2 lacrosse balls tied together because it's easier to hold. So you're going to bend over, slight bend in your knee, same thing. And she's going to do the same passive circles, the same as she was. So passively swinging, bend over a little bit. There we go. Okay, good job. And then this, we're doing 3 sets of 7 just to get strength again. And it's not really, it's mostly to get the shoulder back into some motion it's used to doing since it's such lightweight. But we do want to gear it towards strength. Okay, so for the second exercise in phase 2, we're going to be doing active assisted shoulder flexion. So, and we're only doing it to 90 degrees. We're going to do 3 sets of 6, and you're going to be doing it yourself as well. Lower it. Okay, and I'm just going to help her come up to 90 degrees. And this is just going to be to regain strength back in the shoulder girdle and the anterior delt. Okay, so for the third exercise in phase 2, we're going to be doing no resistance on shoulder internal and external rotation. So she's going to go 3 sets of 8 each direction. So for internal, she's going to start straight at 90 degrees and then come forward. Good job. I'm gonna do 3 sets of 8 for that one. Okay, now external rotation, start with your arm in, move it out to 90, there you go. Good job. So for this, we're just trying to begin strengthening the pectoralis major muscle, just very lightly because it's no resistance, just reintroducing it to some of its primary movements.
Phase 3 will include weeks 7 through 9. Some of the goals for this phase will be to achieve full range of motion in all directions and also start implementing jogging, some other things to maintain cardiovascular fitness, although that won't be shown in this video. In this phase, we want to restrict the amount of resistance we use. We want to keep everything light and avoid excessive resistance, especially in external rotation and horizontal abduction.
So for the first exercise in phase 3, we're going to be doing the shoulder finger ladder. Because we don't have an actual finger ladder, you can just do it against the wall. So she's going to do 5 sets with a 5-second hold at each, going facing forward for shoulder flexion and then facing me for flexion. So she's just gonna walk her fingers up. Do it. No. Okay. This way is okay. Sure. Okay. Walk your fingers up. Good job. And as you get high, the higher you get, move your body in towards the wall. And when you get as high as you feel comfortable, hold it there for 5 seconds, and then slide it back down. And we're gonna do 5 sets of those, both flexion and abduction, not horizontal abduction, sorry. And this is just gonna be to help gain range of motion in the shoulder while lightly getting a little bit of stretch in that pectoralis major. Okay, so for the next exercise in phase 3, we're gonna be doing shoulder internal rotation with a very light resistance band. She's gonna do 3 sets of 6, and this is just going to strengthen the shoulder muscles and the pectoralis major. So start right there straight in front of you and move it, come into your belly button a little bit. And ideally, you would have a bolster underneath her arm and her side, just like that. 3 sets of 6, and be sure you're keeping your abs tight and braced while you do this. Good job. Okay, so for the third exercise in phase 3, we're going to be doing shoulder flexion with a light weight as well. She's just going to be doing 3 sets of 6. This is going to be to build strength in the shoulder flexors, just progressively, starting with this light weight. So, good job, and you're just going to be sure you're bracing your abs. Good job. Just really light weight up, just to as high as they can, comfortably.
Phase 4 will include at least weeks 10 through 12, possibly more depending on how well the patient is progressing through the exercises. Some of the goals for this phase will be to achieve full active range of motion as well as progressively increasing resistance in order to increase strength of the pectoralis major muscle. Some restrictions for this phase will be to limit the amount of resisted horizontal abduction, just to be sure we don't re-injure the muscle.
Okay, so now in phase 4, the first exercise we're going to do is wall push-ups. She is going to do 3 sets of 7 of this. This is just going to begin strengthening the pectoralis major muscle and the surrounding tissues. So she's going to put her arms just a little bit wider than shoulder width apart. Okay, hands a little higher. There you go. And just come down like a normal push-up on the wall. But she has much less weight than a regular push-up. Good job. And if the stronger she gets, she can move her feet backwards, but right now she's pretty close to the wall. Okay, so for the next exercise in phase 4, we're going to be doing dumbbell bench press with very light weight. So she has 5 pounds in each hand. She's going to be doing 3 sets of 6, and this is going to strengthen the adductor portion of the pectoralis major. And it's very light so that we limit the eccentric abduction motion. So just come right down to your chest and come right back up. Good job. Very nice. Be sure you keep your abs braced. Good job. Okay, so for the next exercise in phase 4, she's going to be doing horizontal adduction with a very light resistance band. So she's going to start with her arm straight out to the side and bring it straight forward. Good job. And while you're doing this, be sure keeping your abs braced. Good. And she's going to be doing 3 sets of 8 of this to strengthen the pectoralis major with really light resistance.
And continuing past phase 4, you could adapt the exercises used in previous weeks by progressively increasing resistance or intensity, as well as incorporating exercises that are more relevant to the activity your patient is working towards returning to.